We have a question about letters of recommendation and which letters of recommendation we like to see most. So we'll be totally honest. We want to see SLOEs. And if you're able to get SLOEs, that's what we want to see. And that's what every emergency medicine program wants to see. But this year, my expectation is I hope you have one SLOE. That's what I sort of am expecting to come through. And I'll be really excited if you have one. If you have more than one, you know, that's great, but it's going to be extremely rare this year. For other letters of recommendation, if you can get a letter of recommendation within emergency medicine that is not a group SLOE or is from an elective within emergency medicine, that's probably my second choice. And my third choice is for you to have and CORD put out a letter to be used by non-EM faculty for what they felt represents your performance. That is also going to be perfectly acceptable this year because we just realized that you aren't going to be able to do the number of rotations that you would have done in previous years. So we are going to be much more accepting of other people's opinions on how you performed.
Somewhat related to that question, if we have hypothetically a EM subspecialty that's coming in after October 21st, is that okay to submit that 1 to 2 weeks after that, or is that kind of flag our application as incomplete or late?
Please, please, please submit it because it's something I'll look at. It's someone from emergency medicine, and especially if they worked clinically with you at all, they can reflect on your performance clinically. And in a year where we are, you know, having much less data than we would normally have, I think that really will benefit you even if it's late.
And importantly, as a follow-up to that, it is critical that you have your application complete and ready to go to programs the day it opens. Don't hold your application a week or two for that second letter. We want whatever you've got at the earliest possible moment. We're going to start reviewing applications immediately because we've got a shortened timeline this year and we really want to get to as many of you in as holistic a way as we can. Don't wait. If a letter comes in 1, 2, 3 weeks later, not a big deal. As long as you've got your application complete and ready to go on October 21st, you're going to be fine.
So as a follow-up to that, should we, let's say the letter comes in, should we email you as the program that we're interested in and say, hi, we submitted a new letter, so you're aware of it, right? Because you don't get a notification that we have a new letter in our app.
Yep, that's a perfectly good reason to contact a program by whatever way they sort of specified. Sometimes it's they call the coordinator. Sometimes it's email the coordinator. Sometimes it's directly to the program. Usually it's through the coordinator to update it. And then they'll let us know, you know, if it's somebody who's on our list to review, they'll let us know. Plus, we also periodically go back and look through the folks that we haven't made a decision on to see if there's new information. There's a bunch, you know, every program has a little bit different way that they sort of do everything. And we do have a much shorter window to do it this year. And so the more stuff we have right away, the better. But, you know, most programs are going to look at your application if it has at least 2 letters, preferably 3. So if you're worried about like a 4th letter coming in late, don't worry about that. That's going to be okay.
So just as a follow-up, so I'm an IMG. So currently, like, if I only have a non-residency faculty SLOE, and I have a physician that teaches us at our school back home, our home institution, and they're an EM physician from Canada. And like they wrote us a recommendation letter. I should ask for that in the SLOE format, I've been told by like CORD and CDEM, that's preferred. Does that, do they being a Canadian physician like reflect poorly to you guys, or do you guys consider that? No, okay.
All the best evidence-based medicine's coming from Canada. I think half the FOMED articles that I send out to the residents are coming from EM Ottawa or Canadian EM.
Right.
They know what they're doing up there. So we do not, I mean, emergency is, you know, medicine from Canada. I'll take that over trauma surgery. I will definitely take that over a psychiatry letter, but use those alternative SLOE formats because the problem with other letters has always been that they're written by people who don't get what we're looking for. In that letter, we're prompting them with, here's what we want to know. And hopefully they'll be able to at least address the kinds of things we want to know about you, which has to be better than a long narrative telling us like what a spectacular, like 100-point physical exam you do.
Okay. All right. Perfect. And so if it's like our second or third letter that we are able to get some type of actual group SLOE written after the 21st of October, so that would be a case where you say, worry about that, get that into you guys so you're aware of it.
Yeah, hold a
Because that's a
spot for like
residency.
a true residency EM group
Yeah.
SLOE. Hold a spot for that. But if you have 3 other letters that are in there, your review may wait until that actual letter shows up, but have everything that you can already in there.
Okay. Great. Thank you so much.